welcome back to Health Insurance Sherpa. In the last episode, Kim and I compared Arizona's 7 ACA individual health and family plans in Arizona. Today, we're going to take a deeper dive into something that affects millions of Americans, diabetes and other chronic conditions. So today's topic is like I've mentioned before. There's so much going on behind the scenes that someone shopping for individual health insurance may never discover on their own. And this knowledge is really going to make a difference in the plan you choose, one that works best for you. These are some really innovative plans. And are we finally making health insurance interesting, Kim?
I would say so. So yeah, thanks, Lisa, for having me back. When we talk about insurance, maybe for a lot, that's not an exciting topic, but
That's so
I
important.
do think that is really exciting of things that are happening in our market, of carriers starting to think outside the box of what's something that's going to attract members when they're looking at plans and help manage their care overall. So we're seeing carriers like Oscar is one of them coming to the market with some of these innovative plans, and they're taking into account conditions that people have as chronic needs, what prescriptions they're filling on a regular basis. Really, it's taking not just one piece of the puzzle, but fitting all the pieces together so that they can figure out how to solve some of those problems that people are having. And with these plans, it's trying to provide that as a solution to those that are dealing with those chronic care needs.
Yeah, so especially for them. Somebody that I feel like they are really coming alongside, getting what they need, helping them manage it, trying to keep their costs as low as possible. Mm-hmm. So let's start with diabetes. What would you say would be, who stands out with diabetes benefits?
So we have a couple of carriers in that realm, and when they look at these plans, things that they're looking at is your insulin. What's the cost going to be with that? The medications, the endocrinologist or the specialist visits that they're needing. How often are they getting lab work done? Some of those glucose monitors, just overall, the carriers, including Oscar, Cigna, and United Healthcare, are our three carriers that have diabetes cost share either included in their plan or specific plans that they built for that. So United Healthcare, will start there. They have for members that are diagnosed with either type 1 or type 2 diabetes, so both taken into account under their plans. They have their covered insulin included on their formulary, so those specific insulins that they have listed as a part of their covered insulin on their plans at a $0 cost. And that's probably one of the largest cost share for people with diabetes is that insulin. And that can be so expensive. So having that available at a $0 cost for people.
Yeah, that is just tremendous.
It's huge. It's that for some can help make or break them.
Yes. Just in their monthly budget. Yeah. They need to just make sure it's on the formulary or it's one of the no-cost insulins.
Yes. Yeah. And that's something that Lisa, as your broker can help you do the research. Is really you just need to come with the details on the insulin that you're taking, and not just the name, but it's helpful for the agent to know, is that an injector, a pen injector?
Right, how is it used?
Is it a syringe? What's the dosage of that? Where are you filling it from? So some of those key pieces will help to determine, of these carriers that are offering these cost share reductions for you, which one is going to be the best to fit your needs.
Right. So maybe we start with who their doctor's with, who is their important doctor, and if they're with one of these three companies, then we dive deeper into the formulary.
Yes.
Or we focus on them if maybe they're out open to switching doctors.
Yes.
Right. Just to get these extra benefits, because overall it might save thousands of dollars.
Yes. And sometimes even considering if it's an insulin that's not on the formulary, maybe it is an insulin that you can take that's on the formulary, and going to the doctor to say, is this an option for me? Or
that's a great point.
Am I stuck here with the one that I have? And then that helps to determine what route you need to go.
Yeah, that can work with any medication, right?
Yes.
Find me something generic, something that's on my insurance plan's formulary or the plan I want to join.
Yes.
And that's something we could do ahead of open enrollment too. So
Absolutely.
something you can start researching in maybe September or October as we're gearing up for open enrollment, which is November 1st through December 15th every year, and including this year for 2026.
Yeah, yes. If you have a doctor's appointment, maybe you ask them, I'm on this now, but I know I'm going to need to start looking at my insurance. Can you tell me, are there alternate options that I can consider if needed?
Right, and maybe just have a list of those, maybe 3 options that the doctor thinks would still work for you.
Yes. Yep.
Or you could try them.
Yeah.
Try them ahead of time to know if
Yes.
this is going to work or not.
Right.
If it's on your current plan.
Oftentimes
that's a
they
great
have
point.
samples or something, yep. So with United Healthcare, I'll just also add in there, in addition to those $0 cost insulin, they have 8 other diabetes management services at no cost.
Yes.
So they have their routine diabetic foot care, nutritional counseling, retinal eye exams, kidney function testing, A1C testing, metabolic panels, urinalysis, and lipid panels. So those are all
for free.
We're all at
for
no
all
cost.
United members
For
on the
all
ACA.
of United members, as long as they're diagnosed with that type 1 or type 2 diabetes, that's included in their plan.
Wow.
Yeah.
And I think I've had a few clients too that would say, well, I'm type 2, but if things change, then they're ready.
Yes.
And they have those benefits available.
And having those preventative screenings can help
True.
prevent
it.
making it
Prevention
worse.
is big.
Yes.
Yes, good point.
And that's really why these carriers are starting to come out with these benefits, is to help
Helps
prevent
everybody.
things. Yes, overall, really. Yeah.
We're taking care of each other.
Exactly. Exactly.
So Oscar let's talk about them, because their plans are so unique. They put the description right in the plan name. So let's talk about their brand new plans.
Yep. So they have 4 plans that are condition specific. So they have their diabetes, COPD, their cardiac, kidney, and metabolic conditions. So they really call that their chronic plans. And then their women's health and menopause support plan.
First of its kind that we know of.
Yes, yes. I think we're finally seeing some recognition that women need that additional support as they're going through changes of life, and some of the care that has not been focused on. Now we have a plan that is specifically focused on that.
I actually happened to see one of my providers today for hormone replacement, and they are starting to take insurance.
Wow.
Yes.
Wow.
I can't wait to break this news.
Oh my
So it's only
gosh.
certain providers. So it's the newer providers, like my provider, she's very established, she's very busy. She's like, I'm not going to take insurance.
Yes.
But some providers are taking insurance. So I'm going to learn more about that, and I'll share it later.
That's amazing. That is great
So it's
news.
Tutera Medical, if anybody's interested.
Yeah, actually, I have been there.
Have you?
Yeah, I used to go there personally, and they're great. Yeah.
They are really good.
Yeah.
They're really good. And it's, bioidentical. So it's helped. It's helped.
And even just kind of a side point of that if your provider maybe doesn't take insurance, if you need to go get labs or you're filling prescriptions, those are still things that you can run through your insurance, so long as where you're going to receive those services or the pharmacy is in network. You can still use your insurance for that. So
it's like estradiol. I've had clients with that the insurance will cover, but as far as like the bioidentical pellets and things, so far not covered.
Yes.
And quite expensive.
Yeah. Hopefully that'll change in the
That would
future
be
as we
nice.
see that.
People would be thrilled.
Absolutely. Absolutely. So what is interesting on those plans, and we kind of mentioned this in our last podcast, is while they're built for those conditions specifically, you don't have to have one to enroll in them.
Right.
So you can choose to still enroll in that plan regardless of having those conditions or needing to manage those health conditions. But great benefits included in them.
Right. So tell us about the benefits on the diabetes plan specifically.
Yeah, so they have $0 primary care visits, $0 endocrinologist, behavioral health, any lab work related to diabetes, eye and foot exams that are related to diabetes. And then they have $100 insulin cost share for their insulin. Per month,
Okay.
yes.
Now, the behavior health, that's another question I get quite a lot. Could anybody get no-cost behavioral health with this plan?
It has to be
Diabetes.
surrounding the diabetes. Yes.
Okay.
Yeah.
Just thought I'd
So they
ask.
do have some stipulations around, even if you don't have those conditions. It's not just
For some of the
$0. Yeah.
benefits.
Yeah. And that's where your broker or within the summary of benefits they have to be the same for each carrier. You can see when some of those have the stipulations with some of those benefits.
Okay.
Yeah.
And then the chronic condition, they call it the chronic condition CKM plan. Mm-hmm. Tell us a little bit about that one.
Yeah, so that one is for people who are managing cardiac, kidney, and metabolic conditions. Has $0 specialist copays for providers that they would need to see, like cardiologists and endocrinologists, and then the same $100 monthly insulin cap on that.
Right. So you're looking at hundreds or thousands of dollars in savings.
Mm-hmm. Yes, definitely.
Wow.
Yeah. And then their other plan is that COPD, so helping, and they call it their Breathe Easy plan. Mm-hmm. So that's for those that have COPD or asthma. Helps lower the cost of inhalers and some of the respiratory medications, and then same thing with some of those savings in the specialist visits or the visits to to providers that they're needing to see with those care.
Awesome.
Yeah.
And now how about the menopause plan?
Yeah, so that is designed for women who are over the age of 45, and they want insurance to cover some of those hormonal care needs, and that has that built into the plan. Also helping to cover some of those screenings that women need. So with bone density, things like that is built into those plans for women that are coming up to that age and needing those additional services.
I was actually curious, so I went out to healthcare.gov and went to their provider, the free provider services for women, and they have the women's DEXA scan, the bone density scan at age 65, or you can be under 65 but going through menopause. But so I like that they're including it for 45 plus.
Yes.
Because it could be premenopause or
Absolutely. Absolutely.
something to be aware of and something to get ahead of before you start feeling bad.
Yep, we're back to that preventative care.
Yes, preventive care.
But definitely exciting direction that we're seeing, and it's not really that one-size-fits-all thought process anymore. It's just what can we bring to the table to help with some of these conditions that people are really struggling through and needing that additional care for.
Right. And this year they decreased the number of plans being offered.
Yes.
But I feel like we're getting more personalized.
Yes.
There's still plenty to fit whatever somebody needs.
Yeah, and they are going to open that up again, so I think we're going to see more plans coming to the market, not a reduction of plans. Yeah, so I think we'll see more of this. I really do. I think we'll see more carriers.
It's going to follow suit, right?
Absolutely.
I think it's been successful.
Yes. Yeah.
Just based on my experience with my clients. But
and if nothing else, we're seeing the questions, coming where they're asking, and it's having people think outside of the box of what do I need? What do I want? What can I access within my plan?
Right.
So having just some of those specific plans makes people think about their care more.
Yeah.
And just what should they be doing, either preventative wise or to manage their care better.
Right. And especially if you're offering it at no cost or a much lower cost, it's going to entice them to do that.
Yes. Yes.
Awesome. So then we also have Cigna. I know they're leaving the market at the end of the year, but they have a nice benefits diabetes plan.
They do. And not only do they have the diabetes plan, but they also have a patient program for the plans that are not specific to diabetes. But yes, specifically to their diabetes plan, they have insulin and select diabetes medication at no cost also. They also have some supplies like the pumps and the skin preparation supplies, infusion sets. Those are also covered at a zero or a low cost. They also have their glucose monitoring system, specifically Dexcom and Freestyle devices. And then one-touch glucose monitors are covered at zero. So
nice. I think nutritional counseling as well.
Yes. Yep. They have that included in there as
foot
well.
care.
Yes.
Yeah, that's awesome.
Yeah. So just some extra benefits thrown in there for them.
Right. So that's nice. So United and Cigna both offer some of those no cost.
Yes. Yeah. And then
And Oscar some.
yes, Oscar does have in their diabetes plan. And then just to kind of piggyback off of the enhanced diabetes plan with Cigna, that patient assurance program.
Yeah, they've had that for a few years.
They have.
That's great.
So it caps the cost share for some of those medications and insulin, either at a $25 for 30 days or $75 for 90 days. So maybe somebody's on a standard plan and they're diagnosed with diabetes, that they can't get on a diabetes specific plan.
Right, until the
that
next
still has some benefits built in there for them to cap that out of pocket cost.
Okay. But that's also for people with other conditions too, the patient's assurance.
Yeah.
Patient assurance program.
Yeah. Yeah.
So what is the biggest advice you would give somebody living with diabetes or another chronic condition? Like how they're shopping for their plan, looking at the whole picture?
So really the biggest advice is it's not just premium for
That's
people
usually the
with
first thing they want to
conditions.
look at.
Yes.
And that's natural.
It is.
With anything, right?
Well, because our natural thought is if I can get my premium low, I'm going to save my cost overall. That's not always the case with people.
Not with health insurance.
Yeah.
Yeah.
Not with health insurance. We want you to work with your broker and think about the overall costs of your care in your
Right, the entire year.
Yeah.
Doctor visits, if you have a procedure coming up.
prescriptions, maybe some of those preventative services that you're going to go get outside of the ones that are normally covered by the plan.
Right.
So just really thinking about your care needs overall and not just looking solely off the premium or the carrier name. Maybe
True.
be in the you're coming off a group world and you don't recognize the name Oscar. You don't recognize the name Imperial
Yeah,
or
Antidote,
Antidote.
yeah.
Yep, those are unfamiliar territories for you. Does not mean that they're not good
viable
options for
option.
you.
Yes.
Yes. Yeah.
That's why you wanted to have the conversation.
Yeah.
Talk about everything, and
Yes.
it's important.
It really is. Yeah.
So there's a lot to consider, but I love that you are focusing on the whole picture. I do that with my clients too. What is your care going to look like? How often do you go to your doctor? What expensive medication do you need? What do we need to research?
Yeah.
And then just another pro tip, I throw this out every now and then. If you know you're going to have a procedure or you have high medical expenses where you're going to hit your out-of-pocket maximum, we look at the premium and the out-of-pocket maximum and find out what the lowest number is.
Yes. Yep.
So it's easier to, I guess, pick the plan once you know if you have a predictable health future like that, healthcare expenses.
Yeah. And if you don't, then it's thinking about what is going to give me the most peace of mind with my coverage so that if something did happen, can you afford to pay what your cost share is going to be? Is it
Yes.
going to make your life easier, not harder? So
True,
that's
yes.
the goal of an insurance plan, is to reduce your overall risk in the case that something does happen.
Right.
It's meant to work for you, not against you.
Right. That's a great point. And I tell people these are peace of mind insurance plans.
Yes.
The ACA individual insurance plans or a group health plan, those are really the only way you aren't going to worry about pre-existing conditions. There's no cap on your benefits in most cases.
Yep.
So it's you have your limit of roughly $10,000. Everything else is on the insurance company.
Yes.
Could be $1 million. I've seen that happen.
I the other day was reading something where somebody was saying they went to the hospital without insurance, and they were shocked at how much that just the simple things that they needed. It was for a broken foot or an arm, I don't recall, but just like the acetaminophen costs were $100, or the X-ray was $1,000, and it just adds up so quickly.
Yes.
That
And it's just one accident.
one accident, you can walk into the
Silly
emergency
accident
room.
or a car accident. Yeah.
And when you don't have a cap, you don't have an argument for how much they can charge you.
Yeah.
That you're not getting any help with that. So that's the goal. My 2 cents on that.
Yeah. We both feel very strongly about this, clearly.
Yes.
But we've been in the business a long time. You and I have been working together probably 10 years now, longer in the industry, and
We
that's
hear a lot of
hundreds of thousands
stories.
of clients that we've interacted with. So
Yes.
it happens.
Yeah.
So, well, good.
Yeah.
So a lot to consider. So any final thoughts before we wrap up today?
Yes, I think I would just say I encourage people to ask the questions and to just think about your care and overall needs, not just like we talked about the premium. It's much more than the premium. It's much more about your overall plan, how it can work for you, and knowing what's included in there. And then thinking about those of you that have the chronic conditions, maybe you didn't know these were out there.
Right.
So
or what's included? These free benefits that are included with these 3 carriers?
Yeah. So
I don't, we need to get that out there more.
I know. And
So
don't be afraid of the carriers that you don't know.
Exactly.
That
That's a
may
good point.
not, the one you know may not be the best option for you.
Right, for you. Exactly. For you right now.
Yeah.
Right. Awesome. Well, this was so helpful to get another advisor's perspective and share. Thank you for sharing your impressive knowledge and experience
Yeah.
with us. And thank you for coming back again.
Thank you, Lisa.
So clients are your brokers, or I'm sorry, Mango. So Kim works with brokers.
Me too.
Let me start that over again. Mango again. I'm tired. So Kim works with brokers. So if any brokers out there want to get in touch with you or work with you, how would they find you?
Yeah, you're right. So I do work with brokers to help guide them and understand the market and how to best work with their clients. So if you'd like to reach out, you can either email me at kim.anderson@blackgould.com. Gould is GOULD. And my phone number is 602-776-1336.
Okay, awesome. Well, I'm Lisa Martin, your health insurance Sherpa. Thank you for listening today. Please subscribe on Apple, Spotify, or wherever you're listening from so you don't miss another episode. You can also reach me at lisa@ecafinancial.com or 602-852-5215.
Awesome.
All right.
Yay!